All right, we're going to go over how to add a hamstring isometric with a low bridge position, working our way into a higher bridge position. What this is trying to do is to teach you how to start to engage the hamstring to help with pelvic repositioning. This is all part of our postural correction series of getting the hamstring to help maintain our posture versus just over gripping with the glutes or ab gripping to try to get the pelvis to tuck under us. So what we're going to do is we're going to get into our bridge position with our back flat onto the floor. Now, if you lay down and you find that there's a big gap underneath your back, I first want you to try to see if you can kind of reposition yourself. Just kind of shift around a little bit to see if you can get it flat. If you're shifting around and you still can't get it flat, you may need to put a couple of pillows or a yoga mat underneath your shoulders and kind of prop up a little bit to get that back flat. Otherwise, we want the feet planted with your weight in your front of the feet and toes and even in your heel. So we'll first start by establishing our breath. We're going to do that nice breath in with the nose, and you want to feel that we have that chest and belly rise. We want to have that expansion on the side of the ribs. And most importantly, we want to feel that we're breathing into our back. We always want to feel that we're able to take that breath in with the nose, expanding the diaphragm, getting that back expansion, and we want it to feel easy. I never want you to feel that you have to take this deep breath like you're forcing the air into your back. So reposition yourself if you need to, or use some propping if you need to initially. So what we're going to do is we're going to add a little bit of a heel drag, which is going to activate our hamstring. What that's going to feel like is you're going to feel like you're trying to drag your heel towards your buttock, but we're not going to allow the feet to actually move. And so when we add that heel drag, what you're going to feel is, because the hamstring attaches to the bottom of the pelvis here, is that the sacrum will start to roll up and you'll feel that the low back starts to flatten a little bit more. Once you have that hamstring engaged, you should be able to feel as you're breathing in that it's a little bit easier to take a full breath, a little bit easier to feel that 360-degree expansion of the rib cage. Once in a while, kind of touch the glutes, jiggle them around a little bit to make sure that they're relaxed. And then try to hold it for about 30 to 60 seconds, that heel drag, and just breathe through it. And the full, long exhale. So after 30 or 60 seconds, you can relax. You may be asked to do maybe 1 or 2 more times, 30 to 60 seconds. Now, the next step is we can add a little bit of a bridge or a little bit of a hip lift. But at this time, same thing for now. We want to keep the glutes relaxed. We want to keep the pelvis relaxed. We're going to add that heel drag again, but we're going to kind of power it up a little bit. We're going to feel the sacrum start to roll, the low back flatten. And using just the hamstring, we want to feel that we're lifting the pelvis up off of the ground, just maybe about ½ an inch. Doesn't have to be very high. Glutes still, for the most part, relax. Most of the work is coming through my hamstring, pulling that sacrum up. And then you're going to take a deep breath. You should still get that 360-degree expansion. And we're going to hold that hamstring contraction, the heel drag, for another 30 to 60 seconds. It's a low-grade contraction. Glutes are still relaxed for the most part. pelvis is relaxed, hamstring doing the most work. So that is our hamstring isometric or a heel drag for our low bridge.